This is Melissa Thomas for Florida National News here at the Englewood Neighborhood Center with Dr. Dena Grayson, candidate for Congress. Thank you so much for being here and for your heart for service, for helping people who are uninsured still get the medical services that they need. Kind of talk about that.
Well, thanks, Melissa. Look, I've spent my career when I was practicing medicine treating uninsured patients for free for 9 years. I was doing house calls for free, including in Ferguson, Missouri. I firmly believe that healthcare is a right, not a privilege. So the purpose of this clinic is really twofold. Number one is to provide a much needed resource for people so they can see a doctor when they're sick, get physical exams for some of the kids going back to school that we have here, but also to shed light on what is a travesty in our country, but also really in the state of Florida. Obamacare has done tremendous things. It's allowed millions and millions of people to get insurance who previously did not have it. But unfortunately here in Florida, our Governor Scott, refused to expand Medicaid. So that has left millions without insurance. We have 2.8 million Floridians without any insurance. And here in Central Florida, 20% of people can't see a doctor when they're sick. So we need to just rip open this gaping wound so we can heal, which is shed light on this. Everybody should be able to see a doctor when they're sick. We are the wealthiest nation on earth. People call it a donut hole. When you can drive a fleet of Greyhound buses with uninsured folks through this gaping wound, that's exactly what it is, a gaping wound, and we've got to do something about it.
And you mentioned you had a goal specifically in terms of these free clinics that you wanted to put on. Kind of tell our folks about that goal.
Sure. I mean, my goal is that we never have to have another free clinic again, Melissa, because everybody has insurance, everybody can see a doctor when we're sick. But I will tell you this, I'm not going to quit the fight until everybody has insurance and is covered and has access to quality, affordable health care. We're going to keep having more and more clinics, and we're going to keep pushing this forward to make sure that everybody has the health care that they deserve in this country.
My name is Lina. I came here because I was invited for one friend of mine. She's Puerto Rican, and she told me about this event. I think it's really important for the community.
I think that it's really good to bring the community together to provide health care because it's an essential need for everyone. And there are millions of people that don't have insurance that really have this need, so it's really good to have this.
I just stopped in here because I saw they were doing the free health screenings, and it had been a while since I'd had one. And I'm really glad I did because it turns out I have really super high blood pressure. And I've always been one of those people that has had low blood pressure, so that's not a good sign. So now I know to go get it checked out again in a couple of weeks to make sure I'm going to be okay. But the funny thing is that for the last month or two, I'd noticed that I had weird little tinglings in my arms and legs. It felt kind of circulatory for some odd reason, and now I'm wondering if maybe that wasn't a symptom. So, but you don't want to mess around with blood pressure, so I recommend anybody, if you have an opportunity to stop into a free screening and get yourself checked, definitely do it.